Cuba is next to us. Cuba is a Caribbean country. It's one of the leading countries in the world with regard to tropical medicine, research and development. The last government took a very backward view of the development in Cuba, so we lost out on the training of nurses. Could have had some people trained there. And of course, this new approach of treating people in Cuba was not done. Since I speak Spanish and French, I am supposed to be able to use those for the advantage for the people of Nevis. Minister Herbert, former Minister of Health, we went to Cuba together and he signed on behalf of the federal government. So now, people going to Cuba are processed through this office and they have been getting medical attention at 10 to 15 times less the cost of going over in the United States. And we want to record our thanks to the government and people of Cuba for giving us that another window of opportunity to treat persons who would otherwise have had great difficulty in obtaining the resources to pay for the treatment. That's new. And so we are in prevention, but we recognize people will be sick. So we have to develop the partners. We have an HIV/AIDS unit which is also well developed and has funding from the Global Fund. We're treating people with antiretroviral drugs in Nevis. Treating people with ARVs, providing ARVs, antiretroviral drugs to people in Nevis under the government of the Nevis Reformation Party. With regard to environmental health and solid waste management, we've been phenomenal in that regard. We've bought new trucks, tire baler. We've taken up all the cars, a number of the cars off the island. We've improved the management of the facility, and we've fenced the landfill, and we're looking to develop a new landfill. All of those have happened with our leadership from the management with our leadership from health. And so, in health, all of the critical indices, infant mortality rates, prevention of mother-to-child transmission of HIV/AIDS, maternal health, all of these issues. Now, we are also on the battlefield with our Caribbean brothers and sisters against the chronic non-communicable diseases, diabetes, hypertension, heart disease, and stroke, and so on. Those are the chronic issues. We are working on those, and we are going to continue so to do. Critically, we have to look at all the areas of health annually and be strategic and train people. So right now we have to be looking to train pharmacists, train biomedical engineers, and these are the opportunities, train nurses, nursing. I have a program to assist with the nursing where I'm training, providing them with the CXC subjects, training them to pass these CXC subjects so that they could meet the matriculation requirements for the CFB to do nursing. So all in all, we've been working day and night on all fronts. And the intention really is to create the kind of environment where I like to say it's a new kind of mind in a new and better society. I know we are told that it takes cash to care. But as I said on the platform in the opposition, it takes cash to care, It doesn't take cash to care. It takes a conscience to care. When you have the conscience to care, you will find the cash. In regard to the elderly and their health, we have a massive program for elderly care in Nevis. Home health care program where officers go and visit them, give them a shower, look after all their basic needs. We have a hot meals program for them. We have an outreach program in we have 5 parishes in Nevis. In every parish there's an outreach program for seniors. Right through. We celebrate their milestones with them when they reach 90, 100, whatever years they reach. I have an invitation to attend the 100th birthday of someone who lives in Tabernacle in Singis, but is originally from Cotton Grounds. 100 years on Sunday. have to get over to St. Kitts for that 100th birthday party. That's our own doing. So we've created the kind of excitement among the elderly people, so you don't have to feel neglected when you're elderly, because one day a week you will be with your peers in the centers, and you can be taken out driving and so on and what have you. You can determine whatever activity that is. Then when you reach your milestone with a wedding anniversary or birthday, we come and celebrate with you. So there is really no need for despair, and that is what we sought to do, to bring a sense of hope and to communicate with them that we in the government are fully appreciative of the years they have spent working with us and for us, and that we value their contribution to the society. The psychologists tell us that every human being has a sign around his neck marked, "Make me feel appreciated." That's what we've done for the elderly. So we're working on them, and we are satisfied that our programs are far ahead many places in the region.